Good evening, everybody. I know you're probably tired and wanting to get home. Um, so my name is Michelle Goldbach, and I'm from the Elizabeth Hospice, and I manage the pediatric program as well as one of our care teams. I've been in hospice for about 10 years, and I've been a nurse for a little over 30 years, with the last about 17 being in management. And healthcare can be pretty stressful, but it can also be pretty stressful as a patient. How many here are patients? Okay, and how many providers do we have? Okay. Well, you could probably tell me more about being stressful with dealing with an illness. I can have some empathy. This last year, I became a patient and I had to have 3 surgeries, multiple CT scans, and I can tell you, being a patient is not fun. Being on the other side of that counter, the other side of the stethoscope, was a whole new experience for me. And I don't know about you, but I almost felt like they went through a Rolodex and said, okay, well, you have this type of cancer, so this is how we're going to treat you, but not me as the person sitting across from them. Well, I remember one time meeting with my oncologist, and I wanted to grab his lapel and say, are you kidding me? Really? This is what I have to offer? You have to offer me? So I can understand it from that perspective. Luckily, hopefully, knock on wood, whatever, is gone now. So hopefully. But that chronic stress can really play a toll on yourself, your families, your places at work, everywhere you go. How many of you have been stressed this last week? Any type of stress? Okay. Just driving down here was kind of stressful to make sure I got down here in time, right? So I'm a single parent, although my kids are older. And I work full-time and I go to school full-time. So I do have stress, but it's a different stress, and we all have ways of coping with our stress. So I'm hoping today to just talk a little bit about that and then do an exercise. I do a lot of practice with mindfulness, meditation. I'm a Reiki practitioner. I'm a healing touch practitioner. I do a lot of integrative medicine. I was really thrilled that the physical therapist mentioned Chai and Qigong, because they're such great practices, as well as yoga. Anything to get you in your breath is really good practice for stress. So some of this I'm going to go really quickly through. Yes. Okay. Okay. Sorry about that. Usually I don't use a microphone because I usually have a pretty big voice, but so grief and loss can happen at any time and can be experienced at different levels depending on the situation, and there's no one right way to deal with stress. Some stress is actually good for us, but the chronic stress, dealing with a chronic illness, can really take a toll on everybody. And everybody will have a different exposure to it and a different experience, because we're all different human beings. We all experience things differently. And the grieving and the loss sometimes never ends. I know even for me, there's certain things that I will look in the mirror and just kind of have one of those moments, right? And I call them my little pity moments. But for some people, that's a daily thing for them to experience, and it could be really difficult. Like I said at the very end, it is a human experience to be lived, to be shared, and be understood. So across the continuum, what I mean by this is that you've had this disease, and as soon as you've been diagnosed, your whole world changes, right? And you have to deal with things as the disease progresses. And depending on the severity of the disease and where you're at in the disease process, it affects you socially, spiritually, emotionally, physically. It can affect your whole daily life. It can affect your normalcy of your life. You have to do a lot of adjustments. And your family has to adjust too. So siblings, I notice most of the people in here are not very, sorry, I didn't mean it that way, not very young. I didn't mean it that way. Well, to make you feel better, I was introduced by this nursing group to do a talk a few weeks ago, and they said, oh, she got her bachelor's degree in 1984, and then she looked up and she goes, how many of you were alive then? I'm like, thanks very much. And she goes, no, I mean, you have a lot of experience to share with us. Okay. So don't forget how the siblings are being affected, regardless of their age. And remember that when you're dealing with younger kids, they're kids. We had one 17-year-old in hospice, and he was having a really difficult time with his diagnosis and his disease and in a lot of pain and distress. And so we had a nurse at his bedside. Well, the nurse was out in the front room with the mom, and the 17-year-old was texting his mom, is the nurse gone yet? You know, he doesn't want a nurse sitting at his bedside. So when you're dealing with kids with chronic diseases, you also have to remember they're kids first and go by their development. But friends and families, neighbors, school groups, team members, if you're involved in any clubs, everybody's going to be affected by your diagnosis and the youth groups. And again, this is just reiterating that everybody's impacted when a family member has a chronic illness. So what are some of the mediating factors? Well, the individuals, the age and gender, dependence, the health status, what is their current coping mechanism that they have? What are some things that they do? What is their temperament, their self-concept of their self, and have they had any other previous experiences with death and loss? And then, of course, you have to look at what age were they at the onset of illness, what is the severity of their illness, what is the symptoms, and what is the loss of independence. And I think that's what really affects people when they have chronic debilitating diseases. So how do we help? Well, we can mobilize resources. Just to let you know, Elizabeth Hospice has a huge compassionate care center. We provide a lot of support groups and individual counseling. We have peer-to-peer counseling for teenagers, not all just on for hospice, but any type of loss or grief that is occurring with somebody. And we also take in community members, and it's fee based on a scale to pay. Be proactive, seek out programs like ours or others in the community and your faith communities as well. And then communicate. I can't stress that enough. Is communicate with your family and your loved ones. You know, how is this affecting them? What are some of the things that are really concerning them? What are some things that's important to them that they want to accomplish? And I always have to do my little spiel of making sure you talk to people what they want. What if something happens? What would they want? What if they can't speak for themselves anymore? What would they want? I've been in hospice quite a while, and I think my daughter was 12 when I first started, and we started having conversations about what I would want. And I said, I don't want to die in the hospital. And she goes, okay, well, I'll carry you outside. And I says, no, I want to die in my own bed. And she goes, okay, well, I'll put the mattress in the back of the pickup. I says, no, that's not what I mean. But we have to have those discussions, right? We have to know, even if you don't have a chronic illness, what do you want or your loved one wants? I still need to talk to my kids what they would want because they both drive a Harley, so that would probably be a good idea for me to ask them that. So stress management, I really want to get to the experience. So find ways for them to help. So what do you guys do for stress management? What helps you to relieve that stress when you're having a really bad day? What helps you guys? Anybody? Yoga? Yes. Exercise? Is it like a gym or getting out of nature? Or? Mm-hmm. Right. Breathing, yeah. Nature's a great way to reconnect and to reground yourself. This was a study that was done by Stanford, and they looked at bereavement for kids, and they saw that siblings of kids who were ill had these thoughts. I hurt inside, I do not understand, I do not belong, I'm not enough. So it's important to address things with all members of the family, not just the person who's ill. Again, we have the shadow side, things that we shouldn't do, like belittle, disregard. Instead, comfort and teach and validate no matter what they're going through. So it's probably hard for you to see, but this is a tool that we use sometimes with younger kids and have them fill out. So someone I can have fun with, someone I can tell how I feel, someone I can always count on, and so on. And that seems to be really helpful for the kids to do that. Also, journaling. Journaling is a great way to relieve stress. And artwork. Draw a picture and then journal next to the artwork. And I'm not an artist, but I've used that tool myself, and it's really helpful. And being with friends. So some of the things here I put is being by yourself out in nature, or walking in nature, or being with friends, or being with family. Everybody has their different way of coping and addressing stress. And then the middle picture is your faith, whatever that faith is. Some people really find that comforting. And I think for those who are caring for people of illnesses or working with people who, if you know somebody who's going through this, is just your kindness and your compassion and your awareness for these people. I remember going back to work after my surgery and everybody's like, "Oh, you look so good, you look so great." And I felt like crap. And I remember going into an office going, if one more person tells me I look good today, I am going to start throwing things because I don't feel good and I don't think I look good and I'm tired. And so just having that self-realization for myself was so helpful to get that out. And then I went with my girlfriends to go sit outside at a winery that afternoon and watch the sunset, and just had a discussion with them. So that was really helpful for me. But getting out of nature, exercising, I can finally start exercising again this month, so I'm so ecstatic about that. So mindfulness is making yourself aware. It's kindness and compassion for yourself and for those around you. How many of you have a mindfulness practice? A few of you. Okay, so we're going to do a little exercise on mindfulness. And if you don't feel comfortable, that's okay. So what I'm going to ask you to do is put your feet on the ground. If you want to take your shoes off, you can. And get comfortable in your chair. And I want you to close your eyes and take a nice deep breath. And think about where your stress is in your body today. Where has it been today? Is it in your feet, your head, your heart, your lungs, your mind, because it can't quiet it down? Where is that stress? And just continue to breathe slowly and deeply. And if your mind wanders, just bring it back to your breath. Okay, let's take a cleansing breath really deep in from your belly. And let it out. Take one more. And open your eyes. We start wiggling your toes and open your eyes when you are feel comfortable. So what was that like? Anybody want to share? Relaxing? Yes. Mm-hmm.
30 minutes just breathing, and I'll do like 8 counts or 12 counts up and down. I'll have some like peaceful kind of like rain sounds, and it's just a great way for me to like zone out the day, like remove myself from my day and like enter in, because I value sleep so much. So yeah.
Great. Anybody else want to share? Right, it's peaceful. Someone asked me how I was doing the other day, and I says I feel wired, tired, and fried. Right? Because how many times do we just go from one thing to the next and not take this moment? And I tell my nurses, between your patients, and when I used to teach nursing school, I says you have to stop and take a deep breath before you walk into that room. Because how you present yourself to your patients or to your families or anybody around you is going to affect them. Your energy is going to affect them. So I don't want you rushing in there with a whole bunch of stuff. I want you to sit down with your patients and talk to them and connect with that heart space. That's so much needed in our world today, especially now, is connecting with that heart space and slowing down. And it is hard. But the great thing about this exercise, you can do it anywhere. You could do it in your car, well, unless you're driving, but do it in your car at a stop sign, a stoplight, before you get out of your driveway, before you get out of your car, going into the house, on the couch, before you go to bed, before you get up. It's just taking those deep breaths. Another thing is to imagine the gap between, and some of you who do this may know this practice. When you take that deep breath in, is noticing that gap between the exhale and the inhale. So before you exhale, it's noticing that gap. And then before you inhale again, is noticing that gap. There's different types of mindfulness practice, but basically it's being kind and compassionate to yourself and others. And it's that self-awareness. Any questions for me? I kind of went through the slides fast because I wanted to really get to the exercise. Any comments, questions, anything about Elizabeth Hospice you're curious about? Yes.
I just want to share a little bit. I find that one of the biggest struggles for me in my life currently is disclosure. Like, how much do I tell and to whom? It's almost like a continual theme and battle, and especially with friends or family members. There's so many people in my life that sort of like abstractly know I have the disease, but they don't like know what I'm dealing with, and they don't know the experience. And so I'm getting better. And I found, just to share with the group, like I would say that I was in a period, a year, 2, 3 years ago where, I was just shut down. And recently I've begun to sort of just be more proactive with like selecting people and saying, hey, this is what's going on. And it's been very, very helpful for me.
That's good. I know sometimes it is hard because even with friends or family are well-intended, sometimes they don't understand, and they'll never understand what you're going through, and or they think you're talking about it too much, or they just don't get it. And so having those people in your life where you can really connect and just have no barriers between you, I think is really important. But selecting, because you're right, because sometimes if you run into the other people who really just don't get it, it can cause more stress in your life, and it's almost worth not even going there. Has anybody else experienced that too? Yeah. Yes.
Well, I lost my son to the disease. So one thing that I
Sorry.
noticed was that some of the people that were closest to me are no longer in my life. And that I've got new friends, which are better friends than the ones that I had before, because they support me fully in everything. So that's just something I wanted to mention, that that can happen, and take it as a blessing that you can move on to some more positive people in your life.
Thank you. Thank you for sharing. Sorry for your loss. Anybody else have any questions or comments about stress management? If you do have any other questions or, yes.
I have a question about being a caregiver. So my brother is really ill. He has AMN, but he is 100% confined to a wheelchair, and he's been in and out of the hospital with all these infections, and now it's affecting his lungs. So he's only 54, and now it's really difficult to get, like, he's too young to really kind of get a lot of elderly assistance. And so he's kind of like really ready where he really shouldn't be living by himself. And so it's really difficult for, in that situation, and someone's an adult, to kind of build the support group and get the help that he needs. And even he lives in Phoenix, it's been really difficult to get a social worker for him. And so do you have any suggestions for, what do men with AMN do, like when they get to that point where they're kind of too sick to care for themselves? And so, like, what do people do?
So does he have a regular physician in Arizona?
Yeah, he does, yeah.
Yeah, so there should be somebody within that office that could start helping them with, like here, we have regional centers, and our social workers, have the resources to to tie into that. I can give you my card and see when I get back to the office if there's anything more I can suggest specifically for you, because, there will come to a point where he can't care for himself.
Well, I know, like, I called this doctor's office, and I asked about getting a social worker, and they said they didn't have any. And then they had me call the hospital, and then I called the hospital, and they said they'd only work with you if you're in the hospital. Right. And so there wasn't anyone to kind of help case manage the situation. And then I've made Adult Protective Services reports before, and then they'll go out there for a couple times, and they'll make some suggestions, but then they disappear, and they never do the follow-up work.
Right, and that's really tough because we see that happening too here with CPS and APS. It doesn't sound like I would say, hospice provides such great social services and stuff. I don't know if he is at that point yet, or if he's just having a more difficult time caring for himself.
Well, I think that would help. I think that, like, and I'm a healthcare professional, so I understand with hospice, like, you just have to have a high likelihood of dying within the next 6 months. Like, you don't have to die within the next 6 months.
Right.
And so I think a lot of times, like, and so it's a
we don't go like this. You have 2 days left.
Yes, if you don't die, it's totally okay. And so
Yes.
I think that, like, that does help people. That sometimes they'll get a lot of extra services because they've signed up for hospice. And I've talked to him about that, but I haven't really pushed the issue. And so that is a really good strategy to maybe try to push for hospice. And he doesn't want to have any extraordinary help anyway. So they won't do any extraordinary help, though. So once you sign up for hospice, you can't then ask for, extra rehabilitation or anything like that. So
Right.
I could, that's a
Well, you
thought.
can, but then you have to work with the billing and all that stuff between private insurance and hospice insurance.
And also, have you checked into palliative care, which is
Yeah.
not hospice, but it's helpful.
That would be through his doctor. They may have some palliative care specialist in the hospital, or within the doctor's group, or you can call some of the local hospices because they may have a palliative care program. So palliative care is on that trajectory when you don't really qualify for hospice, but you do qualify for palliative care, and they can help you with resources too. It's usually a nurse and a social worker, and then a physician will come out and evaluate for you.
I didn't think about calling a hospice program in itself, so I could actually call directly the hospice programs and ask questions. So thanks.
Yes, you can. And hospice is not about just the end of life. It's about giving up hope and quality of life, because we want people, we have little babies 4 weeks old on our service, and we have a 103-year-old on our service that we actually had to discharge because she was doing so well. And yeah, so it's about getting the symptoms under control, getting the resources that they need, and even if they come on hospice, making sure that they have the resources that they need. Yeah.
So I was wondering, I have a child who was diagnosed about 5.5 years ago, and at the time, we all tried to handle what had been diagnosed, but we really put a lot of effort into sparing him the details of what might happen or what might be down the road. And, obviously it's a blessing. It's, fast forward 5.5 years, but he's he's pre-adolescent, and we're now dealing with how to roll out the information and, in respecting letting kids be kids and for him and his siblings. I'm just wondering if you have any suggestions. Is it time to circle the wagons and, lean into family time and make sure he feels supported so that he can get the message? I mean, it's an internet savvy age. He has access to the internet. He can look up ALD.
And has he? Do you know if he has?
He has not. His sister has.
Okay.
And so, even when they were little and we got bone marrow typed for a potential transplant if it was necessary. And, my 7-year-old came up to me and said, "What is cancer and do we have it?" Because that's where you got the testing. We said no, and I gave a big, kind of storybook about what, the cells don't get the right message. You don't have it. Don't worry about it. Someday maybe they'll turn your blood into medicine for your brother. But now that my kids are older and much savvier, and I don't know if you have any other suggestions on how to mediate that stress, because on the one hand, we're in our community, this is a totally blessed problem to have. Like, I'm playing my little violin for myself. But at the same time, it's we want to make sure we do it right so we don't emotionally damage them or put undue stress on them. Both my son as patient and to his siblings.
So I would suggest is first ask your son, what does he know? Ask the siblings, what do they know? What do they understand? So you can get a basis. And then I would also ask your son, does he want to know? Is he ready to know? Because he may not be at that place, or the siblings may not be at that place. Even doing like an art project where everybody, draws what they're feeling and then talking about it. So when you're doing artwork like that, it takes some of that stress off, and then it takes the pressure off of feeling like you're in a therapy session, right? Because then you could talk about the artwork. Well, tell me about this. But first I would find out what he knows and does he want to know. And then go from there. Yeah. Does that help?
Yeah, it does. It's, because we just don't know what is appropriate to roll out when. I know of families who, kind of shielded their kids from what their diagnosis was, and then somebody else opens Pandora's box. Somebody else said, somebody else makes a comment or says, "Oh, you're going on a Make-A-Wish trip because, and that is not how somebody wanted anything to roll out." So we're just trying to stay in front of the game so that, so that we can't control anything, but if we could, if we could control how some of this information gets released.
Yeah, and I think communication is key. We had this one young man who had bone cancer and was dying, and we found out that he didn't want to talk to his parents because he didn't want his parents to feel bad. The parents didn't want to talk to him because they didn't want him to think that there was no more hope. So they had this big gap between them, and it was never brought together. So my only other advice is to make sure that you don't let that gap happen, that you keep communicating, but I wouldn't push, right? And do you have a counselor that you guys go to? And
yeah, we recently started having our son meet with a counselor just because, being at this middle school is stressful enough, and then layer on some complicated medical issues. At an age where you don't want to be different.
Exactly.
And you are. So.
What about a peer support group? Is there peers in the community with the same diagnosis or similar chronic diagnosis that I could ask too if the counselors where I work know if there's any?
Sure, yeah. I mean, I know from being at certain hospitals on clinic days for trials we're in, we have met people, but I've never thought about trying to put the boys into contact because they're still at similar disease phases, and just to see if that might be helpful.
Right.
So thank you.
And all you need to do for HIPAA reasons is just, tell the practitioner that you're willing to do that, They can contact the other family. We have families that connect through hospice that we don't know how they find out, but they do because they're online. They're on these websites with similar diseases or the unknown disease websites called undiagnosed. So, anybody else? Any comments? If anybody would like any more resources, I'm more than happy to get information to you if you would like, or if you maybe some of our resources could help you in our Compassionate Care Center. Thank you.